I'm Dr. Tom Cheatham, a family physician, and this component of a series of 4 brief presentations on how to get the most from a medical appointment will answer the question from part 2, which was, how on earth am I going to keep track of all this information? So, how do I record it and present this to the primary care provider? This is another in the Clinical Pearl series, which are some short videos which provide just the essentials in terms of clinical information to help both primary care providers, although other healthcare providers may find this useful as well, and also for people with disabilities and their caregivers, families, direct support professionals, and others, to help them understand and ensure that partnership which will result in the best health care possible for the person with disabilities. So the 4 topics in this series are listed here, and as I mentioned, this is number 3. So at this point, you're certainly asking, how do I remember all of this? How do I organize it? How do I record it? And so on. So I want to take you through 2 tools that can help you, and they're a little bit different. There's some overlap, but I think there's value in both of them. The first is the cumulative patient profile, and this goes through a number of things right up front on the first page the provider needs to know, and there may be some of these the provider doesn't even know she or he needs to know, depending upon the experience and training they've had. So when was the last or the first assessment done? What's the cause of the intellectual disability? Knowing the cause already gives me a shorter list of things that I'm thinking about as potential health issues for that person. And these tools have been designed to try to reflect all possibilities. So as an example, on the etiology, it's definite, probable, possible, and unknown. So often forms are yes or no, and sometimes the answer is, I don't know. I think this, but I don't know. That's helpful to know that level of detail. What about psychological assessment? That can be helpful in so many ways, including diagnosis of an intellectual disability. What's the living situation for the person? Again, there's certain implications to that. And it's very helpful for me to know the level of the person's adaptive functioning. And there's a separate tool on this that outlines some examples of each of the 4 categories of adaptive functioning: mild, moderate, severe, and profound. Unfortunately, some providers will not, some clinical providers won't know that those really are technical terms, and I've had consultations back from specialists who've referred to people as having a severe intellectual disability when really what they meant to say was the person doesn't use verbal communication. It's important to know about consent. So right up front, who gives consent? Is there conservator? If I'm going to recommend anything, I need to know how to approach consent. And then before I see that person, it's very helpful to know what do they find being in the clinic or my office is like. Is it very anxiety provoking? Are there special things I can do to make that more comfortable for the person? And knowing that ahead of time makes it much less traumatic for them, and often for the person, the family member, or DSP, and myself and my staff. Other triggers for behavior I should know about. I need to know how does a person respond to pain? 2 questions I'll ask very early in the encounter is, if someone's with a person with an intellectual disability, how well do you know the person? That tells me how much confidence can I have that they likely can provide really good information. And then also quickly I want to know, would you know if this person's having pain, and how would you know? Because if we wouldn't know if this person, because of their behavior, if they were having pain, I have a very much heightened sense of being able to miss things, because we use pain a lot in diagnosis. And then communication. What's their receptive communication and expressive communication? So that's all right on the front page. Then it goes through a problem list, and we've presented some of this material in the earlier videos. Current medications, and the detail was also presented in an earlier medication. A detailed sheet on past medications with as much detail as possible, and you see that highlighted here. The example I gave was knowing that an antidepressant may take 6 weeks or more to be effective. So to know that somebody was tried on an antidepressant, assuming the diagnosis was depression, for only 2 or 3 weeks would not rule out that that drug was not effective. It may be worth trying again at some point. Allergies, including detail, and again, it's more helpful for me to document that 2 weeks after trying a sulfa drug, the person broke out in a whole body rash. That's much more helpful than a statement that the person's allergic to sulfa. They may or may not be. You know, with an antibiotic, diarrhea can be a common side effect. That's not an allergy. So again, the level of detail, and once some of these things are documented, you don't have to go back and do them. So it's worth trying to get that detail up front. And then immunizations, very helpful. There's at least suggestive evidence, for example, that people with disabilities may be more prone to serious consequences from influenza than the general population. But like so many things, we don't have really, really good information. And then past history and family history, and then personal history. So this form is a way of summarizing that information in electronic version. Here's the second tool, the Caregiver Health Assessment. And in this video, we've included a link to the tool. This is a tool that was developed in Canada, and you'll know that because later in the tool, behavior is spelled incorrectly. But the information is completely applicable here. And it's a level of detail of those questions that the provider will want to ask on a functional inquiry or review of systems. So it starts off with things like allergies and assessment, the cause of the disability, whether there's a genetic assessment, a psychological assessment, the things that we've talked about previously, and then some contact information, and then goes through other elements. But it's the last part of this tool, the detail, that goes from head to toe. For example, if we look at cardiovascular disease, heart disease, high blood pressure, the options here are, is there anyone in, this is family history, is there anyone in the family who's had this? Yes or don't know. Again, trying to take in all possibilities. And you see the other sort of broad categories here. But then the head-to-toe review, that functional inquiry I spoke about in an earlier video, is listed here. And so this is just the start of it. But these are very detailed questions, and you've got several choices. No, don't know, yes, but then more information on yes. So this kind of detail will help that primary care provider, indeed even a specialist, in seeing that person. So the more you can document, the better. And the person can fill this out for themselves. You may be able to assist them, or if they're unable to do it as a family member or as a DSP, you can go through all of these components. So it's eyes, ears, nose, mouth, throat, and teeth. Then it goes to heart and circulation, lungs and breathing, stomach and bowel, bladder and genitals, sexual functioning, and then questions about women's health and men's health, muscles, joints, and mobility. And you see the detail here in terms of all of these questions. Nervous system, skin, thyroid, hormones, behavior, and then mental health and infectious disease. So, and then with a few final questions. You see there's redundancy, but what I think is helpful with this particular tool is the level of detailed questions that you may not think about in terms of that functional inquiry piece. So I think that can be helpful. And once you've worked through that, that's something that you can give to the provider to enter into their record. So hopefully this information now, you have considerable detail to be able to help that primary care provider and reflect the limited amount of time of an appointment. The next and final of the 4 components to this series is tips for a satisfying appointment. Thank you.